My name is Aita Susi. I used to be a pediatrician, and now I'm a child and adolescent psychiatrist, and I work with families and children in the area of ADHD. So, a lot of this you're already familiar with if you have any friends or family members with ADHD. The difficult aspects. They talk a lot, all the time, can't stop. They disturb others, can't sit still. Children will hit each other in class or on the playground because they have so much energy and they don't know what to do with it, and so it just comes out as hitting. Inappropriate comments. Certainly don't listen and lose things, lose pencils, lose homework, lose shoes, lose socks, all kinds of stuff. Certainly homework difficulties. A child with ADD or ADHD can take 3 hours to do a simple homework assignment, and parents are tearing their hair out. And unfortunately, children with ADHD are delayed socially, because they're so into what they want to do. For example, let's say playing football, that they don't learn the social cues. They don't learn how to understand how to be in a group setting and take turns. And this becomes an issue for children as well as adults with ADHD. And they love fun. They love that adrenaline kick. And so there's engagement in risky and impulsive behaviors. And there's also a risk of marijuana or alcohol use if the ADHD is untreated. There was a study done in 2003 that looked at medicated children with ADHD, basically teens, and unmedicated teens with ADHD. 75% of those patients who were on medicine for ADHD did not use marijuana or other substances. So the use of stimulant medication is protective against illegal drug use. There's a concern for some parents that if I start my child on a stimulant, that's going to be like a gateway drug to other medicines. And that's definitely not the case. All right. So the next, imagine raising a child who talks a lot, can't sit still, you get phone calls from the school that they're hitting other kids, don't listen, lose their homework, blah, 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 blah. All of that causes problems with the parents. So here's a little breather here. Dennis Amenis had ADHD. So he's at the party and he blows out her birthday candles because he's so impulsive. He tells Mr. Wilson that, you've got to be 100 years old. There's just no minding yourself if you're thinking it.
Honest.
Oh, they're very honest. Yes. All right. So all of this leads to parental stress. Okay? You get calls from the school about behavioral problems. We've already talked about homework. Everything gets lost. You need to repeat yourself 100 times. With an average child, how many times do you think you have to repeat yourself to get them to put their coat on before leaving the house? What would you guys consider normal or average?
3?
At least 3 times. Yeah, at least 3 times. That's the average child. Now you have a kid who has ADHD. You're talking 6, 8 times. Put your coat on, put your coat on. And if you tell a child with ADHD, get your hat, put your coat on, and get your homework together.
And they won't put your coat on anyway.
No, they won't. No.
What's the point?
What's the point? And you can't tell a kid with ADHD a 3-step process. You tell them one thing. Put your coat on. Let me see you with your coat on. Oh, Johnny, great, you have your coat on. Now go find your hat and put your hat on. You might get something done. And that's exhausting. Because you want to leave the house, you want to get to work, you have to take the kids to school. Every morning planning this, it's an adventure just getting out of the house. We've already talked about social interactions. It's tough. Kids with ADHD need monitored play dates so they learn how to socialize. It takes time. And all of this, well, what if you have ADD too? What if the parent is
Really bad.
really bad? Absolutely. You have a disorganized parent trying to organize a child to get something done.
It's crazy.
It's crazy making, it's exhausting, it's frustrating, and it's a miracle that everybody gets to school and to work on time. And you get extra bonus points if the homework is actually in the backpack. It's hard. So the take-home message is be patient. Be patient. These kids are not doing what they're doing on purpose. They're not waking up in the morning and saying, ooh, how can I make mommy's day miserable? They just are this way, and we as the adults in the environment, we have to kind of calm down and assess and look at the situation as adults and recognize that we just have to work with this calmly. So are there positive aspects? Yeah. ADHD children and adults are really creative. They think, I don't have ADHD. They think in ways that I could never think of thinking. They point out things to me that I would never have seen. It is fabulous being around someone with ADHD. The creativity is enormous. They're darn smart. Whatever they're interested in, they're really, really good at. They're spontaneous. They work very, very quickly because if they're into it, they're doing it. They're good at problem solving because they're out-of-the-box thinkers. I am an in-the-box thinker, and if it's in the box, I'm going to do great with it. If it's outside of the box, I'm the one struggling. They love being outside of the box and problem solving. They're generally happy kids, and there's an emotional sensitivity that goes along with having ADHD. The ADHD children that I work with, they're very sweet. There's a caring, there's an understanding, there's a way of seeing life and being with people that's very, very beautiful. They're sensitive, and they get yelled at a lot. What? You lost your homework again? What? And this actually hurts them emotionally. So frequently kids who are not properly managed with ADHD lose self-esteem because they take things to heart. So, famous people with ADHD. My favorite is Robin Williams, top of the list. I mean, he's fabulous. He can think out of the box all the time. A lot of sports people, Olympic athletes have ADHD. Where would we be without Thomas Edison and his, 1,000 tries to create a light bulb? And then some that Leonardo da Vinci, Galileo, all of these really cool people. I mean, imagine what Salvador Dali's paintings would look like if he didn't have ADHD. I don't think he'd be famous. No. So there's a lot of cool aspects to having ADHD. You just got to learn how to manage it and work with it. So myth versus fact. Myth. ADHD is caused by poor parenting. Not so. It's biological and often genetic. 2 illnesses in psychiatry have the strongest genetic component. ADHD is one of them, and believe it or not, the second one is schizophrenia. Both ADHD and schizophrenia have really strong genetic backgrounds. There's a fear that parents have. If one of my children has ADHD, all of them will have it. Fortunately, that's not the case. It can be the case, but it's not a definite. There's a myth that ADHD is not a disability. Not true. Children with ADHD in school, because of IDEA, and I did memorize this, but I don't remember what it stands for anymore. Individuals with Disabilities Education Act has stated that children with ADHD get specific accommodations at school for test taking and learning. ADHD is a real disability. Medication is the only treatment. No, there are a lot of treatment options, and I'm going to go into some of that. And then kids with ADHD want to behave badly. It's not the case. They don't want to behave badly. They cannot help themselves. And I'm going to explain the biology of it to you in a little bit. All right. So here we go with biology. Here's your brain. What this is, okay, this is where your eyes would be, and this is the back of your head. And so if you were to take my head like this and just slice it in half, please don't do that, but slice it in half like this, you would get a picture of the brain like this. Here's your spinal cord. And this is what I call the bag of worms on the outside. And here's your cerebellum. All right. What's key in ADHD is this area here called the prefrontal cortex. It's right here in the front. And the cingulate gyrus, which is this pink thing going around like this. Let me tell you what the prefrontal cortex does. The prefrontal cortex helps you to look at yourself in a group of people and understand emotions and social context. Prefrontal cortex is the one that helps you decide, oh, I want that now. Should I go out and get it? Or would it be appropriate for me to sit still and not run after the ball that just went into the street? So if you have problems with your prefrontal cortex, you can't make those kinds of decisions. It's like I want it now, and I want it now, and I'm going to do it, and there's no holding you back. Illness in the prefrontal cortex is called the disinhibition syndrome, like blowing out the candles on someone else's birthday cake. Yes?
Is that impulse control?
Yes, absolutely. Impulse control. Difficulties with impulse control. Other aspects of the prefrontal cortex have to do with organizing and planning. So if you have a fifth grader that has to do a project on Bolivia, for example, and you have to do your research, put your note cards together, get everything organized, and then do the presentation, you're organizing all of this with your prefrontal cortex. But if this guy doesn't work very well, or goes offline. That's how I like to look at it. ADHD kids have they have a normal brain, but parts of it just aren't online yet. It's not engaged. Because, and we know this, because when they're interested in something, when they're interested in, let's say, their latest rock and roll star, they can organize, they can think, they can plan, they can do all of that stuff. The prefrontal cortex comes online when they're interested in something. But when they have to do a homework assignment on Bolivia and they're not interested in something, forget it. It's as if this prefrontal cortex went offline and doesn't exist anymore. Cingulate gyrus here. This area here is about corrections. Going over your homework a second time and making sure that all your addition and subtraction is done correctly and properly. Correcting social behavior. And being motivated, okay? If your motivation is down, this part, your cingulate gyrus, goes offline. So when you ask your ADHD child to take out the trash, which is really boring, the cingulate gyrus goes offline, the prefrontal cortex goes offline, the rest of the brain is functioning just fine, but the part of you that makes you motivated doesn't want to work, and the part of you that gets you organized doesn't want to work, and there you have ADHD. It's there, the structures exist, but they're offline.